from the guideline perspective, for Diabetes Canada perspective, in terms of the pharmacotherapy. So my disclosure hasn't changed since the last time I was here, about an hour ago. Anyway, so the objective is to summarize the current and upcoming guidelines for the pharmacological management. So August this year, we published the first guideline on the on MASLD. It is my understanding it was the first one in Canada, so we are very proud of it. And yes, we are focusing just on people living with diabetes, but still, I mean, 70% of the people living with type 2 diabetes has MASLD in Canada. So it is estimated about 5.8 million people are living with diabetes, and about 90% of them have type 2 diabetes. But also we have to appreciate the fact that a lot of people living with type 1 diabetes are actually developing quite a bit of a metabolic profiles, metabolic issues, just like people living with type 2 diabetes. So had a privilege to lead a group, but it could not have been done without the other co-authors. Dr. Harpreet Bajaj is a superstar endocrinologist, and Dr. Ramji, who's a hepatologist, as you just heard, Dr. Chantel Bemur, who's the nutrition expert, and also my co-lead author, Dr. Giada Sebastiani, another superstar hepatologist. I've learned a heck of a lot from everyone. It was almost like a learning on the job. And when it comes to MASLD, Dr. Ramji and Dr. Sebastiani really taught me a lot during this whole process. So the recommendation had really 6 recommendations. So the first recommendation is focusing on the screening on MASLD-related liver fibrosis in people living with pre-diabetes and diabetes. So once again, the emphasis is on the fact that it is not just people living with diabetes, but we also included pre-diabetes as well. And I also wrote there that it's a screening for MASLD-related liver fibrosis, not MASLD, because of the prevalence of 70% of people living with type 2 diabetes actually have MASLD. So we thought that it is just easier and more practical to assume that they actually have MASLD and treat accordingly. But what is very important, as discussed earlier by Dr. Swain, is that it's the liver fibrosis, the actual fibrosis, the scarring of the liver, that really determines the outcome of the patient's health, rather than just the fat deposition in the liver. The recommendation number 2 talks about the hepatocellular carcinoma and cirrhosis surveillance in people living with MASLD cirrhosis. And 3 and 4, we talk about lifestyle modifications, including diet and exercise. And 5 talks about the anti-hyperglycemic agent that we would recommend, and 6, vascular protections in these populations. So because I've asked to talk about the latter 2, so we'll just focus on that. So this is the recommendations on the anti-hyperglycemic agents. So in individuals living with type 2 diabetes and MASLD-related liver fibrosis, specifically F2 and F3, then pioglitazone and subcutaneous semaglutide were recommended. Now, what I would like to highlight is the fact that during the literature search, we went through the oldest studies that were published until May 23rd, 2023, and therefore the Essence trial and the Synergy NASH trial with the semaglutide and tirzepatide respectively were not available at the time of the literature search. Therefore, we could not include them. And then I'm sure there would be some questions about the SGLT2 inhibitors. Yes, that was not included because we thought the data was not strong enough to make into the guidelines, as Diabetes Canada has a very, very strict way of coming up with the recommendations and the gradings. So with the pioglitazone, so it received a grade A level 1 evidence. I know many people, especially in Canada, do not use pioglitazone. I do use pioglitazone, not as one of my first line therapy, because obviously it is associated with a number of other potential issues like weight gain. We think about pioglitazone, 30 milligrams can cause about 2% of the weight gain, which is very similar to the weight gain that you will see with sulfonylurea. Now, subcutaneous semaglutide, obviously, we have a lot stronger evidence than that it deserves, not grade D and level 4 evidence. However, at the time of the actual literature search, Essence trial was not available. I'm sure with the later next iterations, subcutaneous semaglutide will receive a lot higher grading than what we have given, and I have no doubt that tirzepatide will make into the guideline as well. And then the vascular protection guideline recommendations, we said that individuals living with type 2 diabetes and MASLD should be treated with statins, which can be continued in the absence of decompensated liver cirrhosis to reduce their cardiovascular risk. Now, we've looked in all the guidelines in Canada to see if they made any recommendations about statins as to how much of the liver functions can it tolerate. So the question was, can we use a statin in liver cirrhotic patients, whether it's a compensated or decompensated? And unfortunately, there were no guidelines that we could find that actually talked about how low of the liver functions can we actually use a statin. So then we went to the global guidelines, and we decided to be in line with the global guidelines, where up to the compensated liver cirrhosis, then it's okay to use statin. And this is very important because you have to appreciate the fact that about 70% of these patients actually have cardiovascular disease. Therefore, statin is very important. Yes, there is a small study using a rosuvastatin that can potentially, maybe reverse the fibrosis, but it's like a really, really, really small study. So therefore, we cannot make a recommendations on usage of statin to actually treat MASH itself, but it's really for vascular protections. We also looked at the data such as like aspirin, and we felt that the aspirin data was not strong enough to make into the guidelines as well. So I do believe that the CASL team is also coming up with their guidelines or position statement. At the moment, I do not believe it is available. It is currently in development. I had a chance to attend a preview of the CASL guidelines presented during the Liver Week conference on February of this year. What I got from them was that it was not too dissimilar to the AASLD guidelines, but obviously we need to have a full publications and full readout of these guidelines or the position statement, which I believe will be happening during the liver conference on late February, early March. So we'll look forward to that. But I am not part of this guideline, and I don't have much insight as to when this will really be published. Okay, so that's it from me. So would like to take time to take any questions. Oh, and I forgot to mention that we do appreciate the fact that there is also a data with metformin, but metformin was not studied to reverse the fibrosis or to improve MASH. However, metformin seems to reduce the incidence of liver cancer, hepatocellular carcinoma. So I would strongly still recommend people with type 2 diabetes still to be on metformin. Are also studies with the ACE and ARBs as well in terms of reducing the fibrosis. Once again, the study was not strong enough to make into our guidelines, but Diabetes Canada in general do recommend metformin as a first-line therapy, and also the ACE and ARBs as well as a choice of a blood pressure anti-hyperglycemic agent. Okay.